All right, so this is part 1 of vaccine preventable bacterial disease. We're going to start off here with public health statistics from 1880 from Ontario, and they list the 12 principal causes of death here. So it's kind of interesting because they've got things like heart disease all lumped into one big thing. They've got pneumonias all into one big thing. They've got lung disease all lumped into one big thing. So it's kind of interesting how our diagnoses have changed through the years as well. All right, so the first disease we're going to look at is diphtheria. Now, its other name, well, it's got a couple other names, but one of the names it has was called leatherhide. Now, we still have 1 to 2 or even more cases in Canada a year, right? So it's one of those things you're vaccinated against. The diphtheria bacteria tends to just live in your upper respiratory tract system, so it's always around, and it still is currently around worldwide. Okay, its transmission is respiratory droplets again, so coughing or sneezing. And like I said, it once was a major cause of death and illness in children. There's about a 2 to 7 day incubation time period there. It was most serious in children under 3. So this is why we vaccinate young children, because we don't want them to die of these diseases. So some of the signs and symptoms, they'd have weakness, a sore throat, a fever, a swollen neck glands, and you'll see a picture later on that talks about having a bull neck, so great big fat swollen lymph nodes. All right, now what? All right, so this bacteria produces a toxin. So the immunization for this is going to be a toxoid vaccine. We can also give an antitoxin to it as well. So what ends up happening is the toxin, you've got the bacteria that are attached to the cells, and then you have the bacteria also producing a toxin. And what those toxins do is they kill the cells that are lining the respiratory system. And so the combination of the dead cells plus this glut of bacteria help form a thick gray sheet called a pseudomembrane that's in the back of the throat, and it can actually stop the person from being able to breathe. Right? The toxin can also destroy the heart muscle or nerves. In 1800s, an antitoxin was developed for it, and the treatment nowadays, if you end up with diphtheria, is to use the antitoxin and the antibiotics. Now, this thick gray sheet, you would think to yourself, well, can't you just like poke a hole in it or whatever it is? But it was quite thick, and it was really hard to get through. So if you ended up forming this great big thick gray sheet in the back of your throat, doctors had to puncture, give you a tracheotomy to try to get a hole in there for you to breathe. All right, so the bacteria that cause this is a Corynebacterium. They kind of look like clubs. So the bacteria we also call the Strangling Angel. It is gram-positive and it's non-motile, so it's not able to move around on its own, which is why it has to be transferred through respiratory droplets. Right, so here's what a child would look like with the great big bull neck, with the great big swollen lymph nodes. Like that's a massive swollen lymph node. All right, now you could have a cutaneous diphtheria, which means it's on the outside of your body, or you could have the respiratory diphtheria. All right, so here's what the membrane kind of looks like, this grayish thick membrane that's starting to form, and that would form all the way across the back of the throat, preventing the child from being able to breathe. So they'd literally be suffocating. All right, here's a cutaneous diphtheria injury. Here's a wee baby that's had to have a tube put in so that the child can actually breathe. Now, diphtheria was quite, because it was, killed little babies, it has quite a lot of history behind it. So I'll get to that history in a minute, but here's the number of cases in 2017 in Canada for the number of cases of diphtheria. So that's only 2-3 years ago. The stats for anything past that haven't been out yet. Now here's something that's a great piece of Canadian history. It's called the Mercy Flight of 1929. What happened was this guy, his nickname was Wop May, or his nickname was Wop. He actually has a real first name. He actually was a World War I flyer, and he actually fought the Red Baron, the famous German fighter pilot. So he came back from World War I and just had this taste for adventure, and him and his friend opened this bush pilot business. Now at one point there was a diphtheria outbreak in the northern area of Canada, and it was a snowstorm and all sorts of stuff happened. And Wat May was the guy that they wanted to be able to bring the antitoxin up to these children that were up in the northern part of Canada. And of course, it's the story of how there's snowstorms, and the antitoxin had to stay warm the whole entire time. So they had the antitoxin in like wrapped up with warm coals, and they kept them like in their boots. And then after a while, the hot coals weren't hot anymore because they had to stay for a night because of the snowstorm, so they put the antitoxin down their shirts to keep them warm. Because remember, this is an open airplane here, so it's quite an interesting story, and he's quite a Canadian hero. All right, now this is I'm going to link this YouTube video later on for you guys to have a watch. It's only 5 minutes long. It's one of those Canadian vignettes about, you know, Canadian history. It's actually pretty interesting, and it'll get a little bit into the story about the adventure of these guys. All right, you may have seen this movie Balto. So Balto, this, of course, they made it into a Hollywood movie, but Balto was a dog that led, he was half wolf, half dog, and he brought a dog sled of antitoxin up to the children in Alaska. And of course, in the movie, well, in real life too, he had to fight through a snowstorm and all sorts of stuff. There was actually quite a few dogs that did this. He did the last leg of it, but he was like this crazy hero dog. And then after a while, when he was no longer the hero dog, they sold him to a traveling zoo, and now people who adored his history bought him out of the zoo, and when he died they had him stuffed, and now he's in a museum, I think in Ohio somewhere, in Cincinnati. But there's also a statue in Central Park in New York that commemorates his great trip. And the Iditarod, which is a dog sled race in Alaska, is actually in honor of this trip of racing the antitoxin up to the children who were dying in Nome, Alaska of diphtheria. So it's kind of interesting stories, you know, both Canadian and American story. And my kids love that video. So if you ever get a chance to watch it, it's quite cute. If you're babysitting or whatever, it's quite cute to watch with your kid you're babysitting, or younger brother or sister, whatever. Okay, so here is the little backyard barn building at University of Toronto. It's now Connaught Industries, or Connaught Laboratories, I should say. And here's where they were making the antitoxin for diphtheria. Now, before that, they had to import it from Europe, and finally they decided, let's just make our own antitoxin. So they went and got 5 horses that were literally on their way to the glue factory and brought them here. And what they would do is they would inject the horses with a little bit of the diphtheria bacteria, or the toxin, and the horses' bodies would build the antitoxin to it. So then they would draw the blood from the horses and isolate the toxoid from that, or the antitoxin from that, and then be able to inject people with it. They also did a lot of the tetanus antitoxin in these laboratories as well. All right, so it's kind of neat. This was in 1913, 1914. So then Canada was like, let's do our own thing. And they decided to get the recipe. Oh, here's Connaught Industry. All right, this is like what they decided to make on their own, this whole diphtheria tetanus toxoid with the pertussis, so the whooping cough and the polio in there, all given in one shot, so that you're not having to go back a million times and, you know, give a baby a whole pile of different types of shots. Here's the public health notification from Hamilton showing people. Here's the number of cases before immunization in 1922 of diphtheria, and this is how many deaths we had in the city. And here we are now. We've only got 5 cases of diphtheria and no cases of death. All right, here's what you would have had on your door if you ever ended up, if you lived in Manitoba and you had diphtheria. So these were people who were really in quarantine. All right, here's the global annual reported cases of diphtheria up until 2016. These are countries that still have breakouts of diphtheria like constantly. All right, I'm going to go back a couple slides because I can't. The one slide that was earlier showed the difference between the number of cases of diphtheria before and after vaccination. You can really see that how it dropped off. Okay. Oh, I thought I had a picture here of the recipe for how to make the antitoxin, but clearly I didn't. All right, So the next one is whooping cough. So it can also be called a 100-day cough. Its scientific name is Pertussis. Again, this is airborne, so you figure if you're coughing, you're definitely spewing out particles. All right, its incubation rate is 9 to 10 days, but it can be contagious for up to 5 weeks. So you could be coughing around all over the place and spewing off Pertussis bacteria for 5 weeks. All right, so what Pertussis does, the bacteria, is it attaches to the cilia of the respiratory tract, so it's hanging onto the cilia, and basically it produces a toxin which paralyzes those cilia, so you can't move mucus or particles in and out of your respiratory tract. All right, so that toxin damages the cilia. And this is Bordetella pertussis here, kind of cute underneath the microscope. It is aerobic, so it needs to have oxygen. It doesn't move on its own, which is why you have to cough to get it to spread from one person to another. All right, this is an encapsulated one, which is really important because it's got to stick onto those cilia. So remember, the capsule helps the bacteria stick onto cells. It's a coccobacillus, so this is one of the ones that's not quite round but not quite rod-shaped. It's kind of in between the two. So the symptoms, you're going to end up with a runny nose, sneezing, a low-grade fever. Remember, low-grade fever is just above normal, or a couple degrees above normal. And the proximal cough with a whooping sound. So you're coughing so much, all your air is completely going out of your body. All right, you're probably peeing your pants. You're coughing so badly, and then in order for you to get air back into your lungs, you're making a whooping sound. Like if you ever get the air knocked out of you in sports, and then you're trying to get it in, and you're making that funny noise, this is what you'd be doing in between your spasms of coughing. All right, cyanosis, because you absolutely cannot get oxygen into your body because you're coughing all your air out. Right, a lot of times you cough so much you end up vomiting as well. Alrighty, so complications, like I said, loss of bladder control. All right, you can actually break your ribs. I remember when I was in, we went to Scotland one time we were young, and we were down in London, England, and my aunt had whooping cough, and I had to switch the gears for her on the car because she coughed so badly she couldn't hold onto the car wheel and shift the gears while we were driving. So I had to like do the shift for her, and we ended up having to go to the hospital, and she had broken some of the ribs because she had been coughing so badly. Again, you can end up with pneumonia. 1% of babies die from whooping cough. So again, this is why it's really, really important. If you have a newborn child, you want to make sure that everyone around that newborn child has been vaccinated against whooping cough or has had their booster shot for whooping cough, because you just don't want to take that chance of your own baby dying because they end up with whooping cough. All right, you'll end up with broken blood vessels in the eyes, which can happen anytime you're coughing a lot anyway. And you might think, okay, well, if I get whooping cough, I'll just take some antibiotics. But antibiotics only tend to work if the disease is caught really, really early. And normally people just think, oh, I have a cold, and then they leave it for, a week or whatever. And by that, it's too late. You can only treat it if it's caught really early. Other than that, you just gotta wait out the 100 days of crazy, crazy coughing. Okay, so there's a wee babe that's has whooping cough and is in the ICU. Or the NICU, I guess. Here's a wee baby coughing. Here's the broken blood vessels in the eyes. All right. So here's some of the one of the patent medicine treatments for coughs, colds, asthmas, croup, bronchitis, whooping cough, and consumption. So consumption was tuberculosis, which also caused a lot of coughing. Right? Coughs, cold, asthma, croup, bronchitis. All these things cause coughing. And basically, if you remember, once again, this had a lot of opioids in it, which actually decreases the cough reflex. Okay, so here again, here's our pertussis antigen. So this is our antitoxin for the whooping cough. Alrighty. Oh, here's the recipe for the pertussis vaccine. All right, so here's basically how they made the pertussis vaccine. Because at one point, Canada was tired of importing things into Canada. All right, we wanted to have our own, so here's our own recipe for producing the antitoxin or the vaccine for pertussis, which was a toxoid vaccine. Okay, here is the incident rate per 100,000 throughout the world. Okay, ours stays quite low because we have done a pretty good job at vaccinating against whooping cough, but we've got other countries that are still way behind, especially places where there's been a disruption in normal healthcare. All right, so pertussis is still worldwide. There was an outbreak in June 2016. I think I told you about this, where there was a busload of kids that were on their way to a field trip somewhere in the States, and the OPP actually had to race down the highway and find the bus and turn it back because of this outbreak of pertussis. All right, let me see what else I have here for this. Okay, so you need your booster for pertussis when you get older, and you also want to make sure that if you're a pregnant mom that you're up to date on your vaccinations, because you do not want to have whooping cough with your newborn baby, and you want to make sure that everyone who visits your newborn baby is also up to date on their whooping cough vaccine. Okay, now the next one is tetanus, which is also called lockjaw. All right, so this one still, again, is like it's around everywhere. Okay, so developing countries, Asia, Africa, South America, they have about 10,000 deaths per year from this. There's been 6 deaths in Canada since 2000. In 2015, an unvaccinated child in Ontario ended up with tetanus. They gave him, let me see what I have here. Oh, anyway, but the treatment for this right now is the antitoxin. Plus, you have to give. It'll make sense when we get to it, when we give them sedatives to try to decrease muscle spasms. So they got 4 doses of the antitoxin and a booster to try to prevent the child from dying with this tetanus. Okay, so how does the bacteria for tetanus enter the body? All right, so this is why tetanus is everywhere, right? That tetanus bacteria lives in dirt, so it's not like you can avoid, you know, anything and tetanus is just around us all the time. Okay, so you can have a puncture wound. So this is, you know, where they say, oh, you step on a rusty nail, but it doesn't have to be a rusty nail. It can just be anything that punctures deeply into your flesh. All right, we can get it from bites. You can get it from burns. So with a burn, you've got an open wound, and you can just get it, you know, just dirt gets in there, whatever it is. And again, if you've been injecting drugs with dirty needles or in dirty area with needles, that's another way you can end up with tetanus. All right, so the vaccine is a toxoid vaccine. And the treatment, if you end up with tetanus, is antibiotics. All right, aggressive wound care. So what they have to do a lot of times is go in and remove the flesh from around the wound to try to clear out all the bacteria, and also give you the antitoxin. All right, so what ends up happening? Well, that antitoxin causes a real problem for your muscles. All right, so it's caused by Clostridium tetani. All right, these guys are also kind of club-shaped. All right, they are gram-positive bacteria, so you can see here that they're purple forming or purple colored. They're spore forming, so they can survive conditions for a long, long time and then hatch right when conditions are wonderful. All right, they're rod shaped, but they actually look like a little club, and they're anaerobic. Now you may think to yourself, well, our bodies have oxygen in them, so I don't understand how, if we get punctured and the tetanus bacteria gets in there, how that will cause a problem. But it does cause a problem because deep in your flesh isn't as high oxygen as it is like outside in the air. All right, so it's low oxygen air deep into your flesh. All right, the other thing for this is a lot of supportive care. Okay, so what ends up happening is you end up with jaw cramping, because this is why it's called lockjaw, because those muscles lock. The toxin causes the muscles to lock. You get muscles that start to spasm, especially muscles in your stomach. You get body muscle stiffness. You have trouble swallowing. You end up jerking or staring, so you end up having some seizures. Obviously a headache. I'd have a headache too. Fever and sweating, and you have changes in your blood pressure and your heart rate. All right, so here's a painting from like a long time ago with somebody with tetanus. So your muscles have literally tightened up and spasmed up that much that you end up like cricked backwards. All right, now the next picture is a little bit disturbing. So this is neonatal tetanus. Now this is still a problem in the world, especially in countries where people live in unsanitary conditions. So still in areas in Africa and some parts of Asia. There's about 2.6 billion people in the world who live in unsanitary conditions, and babies are born into those conditions. All right. Now what ends up happening a lot of times is they cut the umbilical cord. If you've got a mom who's giving birth in a dirty hut, well, it's a dirt floor, and they've got inexperienced, women that are there, not a proper midwife, and they believe in a lot of old superstitions, and they're cutting the umbilical cord with basically whatever they can find. And a lot of times they treat the umbilical cord with dung or with ashes, or sometimes with spit or salt and herbs or whatever, so they kind of put that on the umbilical cord. The babies end up with tetanus. All right, so here's a little thing that shows you here in Papua New Guinea here in 2011. So it's just showing you some of the cases of neonatal tetanus. Age of the mom, just young here, 16, 29, 33. First pregnancy, no, so they've had more than one child already. Antenatal care of mom. So antenatal care basically, has the mom had antenatal care? A lot of times what that means is making sure that the mom is updated with her vaccines as well, because she can give the baby some antibodies through her own blood system while the baby is in development, and then the baby's born with some antibodies. But these guys didn't have prenatal care. Did the mother get the vaccine before? And this goes with the antenatal care, because if not getting antenatal care, then who knows. All right. Delivery conditions, so floor at home, floor at home, floor at home. Who was there to help her give birth? Untrained relative, untrained attendant, untrained attendant. So keep in mind, a lot of these people don't know the importance of keeping things really, really sterile. How did they cut the cord? An old razor, a bush knife, and a bush knife. How did they tie it off? Oh, they used strings from a used rope, used strings from a rice bag, used strings from a grass skirt. When did the baby show symptoms? Day 5, day 7, day 12. And luckily 2 of these 3 babies didn't end up dying. If you can get the babies through the first 2 weeks, a lot of times they can end up recovering. But as being little newborns, they're really fighting for their lives during the first few weeks of their life, okay? And they figure the number of neonatal tetanus cases in all these countries is vastly underreported, okay? So here is the leading cause of death. It's called the silent killer because infants usually die before their birth is even recorded. So this is, well, this is 2002, but this is basically the hot spots for where neonatal tetanus actually occurs. So what the Bill and Melinda Gates Foundation and UNICEF and all those places, what they try to do is educate the moms, all right? Also make sure that vaccination programs are running well. Make sure that the parents understand, or mostly moms, because the dads aren't really around for all this kind of stuff, to make sure to use clean instruments, to make sure everyone's hands are clean, or as clean as they possibly can get them, and to don't put anything on the umbilical cord, just to let the air dry it naturally. All right, the next one is Hemophilus B Influenza. So this is an influenza that is caused by a bacteria, all right? Alrighty, so how's this transmitted? Once again, we've got coughing and sneezing, so anything that comes out of your face, all right? 3 to 6% of people who contract this end up dying, so it's pretty, good that we're vaccinating against this, because we've dropped the mortality rate down 95% since vaccination for this type of bacteria has started. Okay, so what are your signs and symptoms? You can have a fever. Obviously, you're going to have chills if you have a fever. Shortness of breath, because again, we're affecting the respiratory system. All right, and then we may lead into having muscle aches, but that's the least of your worries, because we can end up with ear infections. We can end up with meningitis. Meningitis is going to come up a lot whenever we have an infection of the meninges. We're going to end up with meningitis. Pneumonia, okay, obviously here we go back into pneumonia again. And then the scary thing is we can end up with sepsis or blood infections too, okay? So the antibiotics are the treatment for it, but only half of the children, once they've developed meningitis, survive. So again, the best thing to do is prevent this from happening at the first place. Now, who is more at risk? Anybody with an implant, okay? So if anybody's had a transplant of any type at all, they're at greater risk at ending up with influenza type B. Anybody who's had a cochlear implant, transplant, anybody who has an antibody deficiency, anybody who has any problems with their spleen, anybody with HIV immunodeficiency. So again, this is why we want to make sure that everybody surrounding any of those people who have those problems are surrounded with people who are vaccinated against this disease, because you don't want to be the person who hippity hops over, breathes on somebody who's immunosuppressed, and you cause them to end up with HIV and then they end up dying. Okay, so here's these guys. Again, these are encapsulated. Remember we said the encapsulated vaccine, or vaccine bacteria, when you look at them under the microscope, it looks like they have a halo around them. All right, so this is what they look like. They are gram-negative bacteria. They've stained red. They're another one that are coccobacilli, so they're a little bit rounder or a little bit longer than they are round. This looks pretty rod-shaped to me. I won't ask you what shape the bacteria are anyway. I just want you to recognize that, you know, an encapsulated bacteria can stick onto cells. They are aerobic. They live in the respiratory system. All right. They can be encapsulated or non-encapsulated. Okay, so here's a wee babe that's got some blood infection that's happening, and here's a little girl. She does not look very happy with her infection. Okay, so our last one for today is pneumococcal pneumonia. So this is another one that we give little wee babes. Okay, again, pneumococcal pneumonia. We've got our pneumonia again. Anything that comes out of your face is going to be able to spread that bacteria around. Okay, signs and symptoms again. We've got a fever, we've got our chills again, we've got our cough again, we've got our difficulty breathing again. And what we say is it sometimes can lead to MOPS. Okay, so MOPS is going to be meningitis, otitis media, which is basically our ear infections. And this pneumococcal bacteria they found causes half of all ear infections in infants. So again, an ear infection for a kid is not a fun thing at all. So you want to make sure your child doesn't end up with ear infections. Ear infections can end up with hearing loss. You can end up with scarring of the eardrum. You can end up with deafness in that ear. So you really don't want to just fool around with ear infections. All right, my one son has scarring on his eardrums, and he's actually got a punctured eardrum on one of them because he had so many ear infections when he was little. All right, and again, we can end up with pneumonia and we can end up with sepsis. So similar thing to our bacteria before, can always end up with the same type of MOPS syndrome there. Okay, now here's our Streptococcus pneumoniae. So this is our bacteria. Again, I'll never ask you for the name of the actual bacteria. I just want you to recognize, like, just know, see the names, and then you are kind of familiar with the names if you go off and do any of this stuff in microbiology. So these guys are going to be gram-positive, so they're going to stain purple. And look how cute they are together. This is a Diphtherococcus one, right? So this is one that likes to travel around in twos. Now these guys can be aerobic. They're mostly aerobic, but you can have anaerobic forms of it as well. Okay, and these guys naturally live in the respiratory tract of all humans. So we're all walking around with Streptococcus pneumoniae, all right, our good bacteria, keep them in order, all right, but the minute that you start to get run down, all right, so say you have influenza from the influenza virus, all right, and you're laying around not feeling very well, you're all immunocompromised, well, hoo-hoo, guess who gets to live it up merrily? These guys will take over and then end up causing you to end up with pneumonia. Okay, so here's some sepsis again. This is what happens. You end up with sepsis. So this is blood poisoning. You can you actually end up losing limbs when you have sepsis that may not be treated. Okay, here's your meninges around the brain, and then, so this is all being infected, and this is all pus covering the brain here. So this is what meningitis looks like. Okay, this is pus in those little craters of the brain. Okay, and there's a huge big boil from Streptococcus infection.